Thank you, everybody, for coming. You know, we're gonna start here with the agenda. Um, Stick to the basics. That's a big one for me. Foster hope and be an example. Communicate and educate. Stay connected and self-care to close out. So with stick to the basics, um, what I mean by that is, always keep a center, a frame, because you're going to encounter things, because a lot of times we're the only peer, or there's only a very few peers in the clinical department, and it's still a newer thing, so to speak, and it's a whole different mindset, right? And there's biases, there's prejudices, there's just not knowing about what we're doing. We're pioneers. We truly are pioneers, in every word. So rely on your training. I always go back to the modules online. I always go back to the text. And I always try to stay focused on these principles that really my mentors early on in my first job as a peer in Olympia really always stressed on me, not stressed on me, but encouraged me to do, and that's being person centered. So it's all about the peer, right? We're there for the peers. They should be talking, and it's about them, all about them, not about us, not about what the doctors want you to. Hopefully, yeah, and I let them know that, hey, I'm not here to do that. It's if they don't want to talk about that stuff, I'm not. I could maybe ask them a question, an open-ended question, but at the end of the day, it's centered on them, and they might not want to talk about that stuff. And maybe they already have it figured out, or maybe they don't, and they don't want to, um, strengths based. I always listen for things they enjoy, because a lot of times, our peers enjoy things, but they don't. They're just so broken and down on themselves, or in a situation where, and that's where I let them know that sounds like a strength. That sounds like something you're really good at. Why don't you look into doing that for work, or why don't you, you know, encourage them and let them know they do have strengths. They are worthy of praise. They are worthy of goodness in life. They do deserve the best that life has to offer, no matter what they think, and that we're there as peers to walk alongside them in any way, shape, or form they need to do that. Right. Active listening, right? That goes back to the strength space, listening for things like that to really encourage them, really give them hope, really promote those things like resiliency and self-advocacy, and encourage them to keep going. And again, peers lead the conversation. um we're not there to tell them about us at all. I try to stick to like a 95-5 rule, where I would ideally I want the peer talking 95% of the time, and then I'm talking 5% of the time, and that 5% is, showing that I'm orienting with them, showing that I'm listening, reciprocating some of the stuff back to them, repeating what they've said, to show that I'm listening, and highlighting strengths, and encouraging them to use that they have the power, to use that space for that. Not giving advice, right? Not saying, well, I think you should. I use one thing I learned in training was, some people might, um, or what do you think about that? Like, encourage them to just seek it. Um, some people use motivational interviewing as a tactic. I think it's good to train on it and to learn it, but again, I think our job is not to be formal or medical. So I try not to be too myself. I try not to be too robotic about it, but I definitely think it's worth learning. Um, you know, the motivational interviewing stuff to have as a foundational knowledge base. We don't give medical advice. So I've had a couple times where, people will ask me about, well, can you ask them about like their what their how their bupe is, or their methadone, or what they think about it. And, I let them know, hey, I can ask them for you, but I'll let them know that's what you're asking about. So I'll say, hey, the doctor asked me to ask you this. And then, I'll leave it at that. And if that leads to a conversation where they maybe ask me what I think, I let them know that, hey, I don't have a medical degree, um, but my team is great. They're strong, and we work together. And I can assure you that the same mindset that I have to be there and help you, be healthy and alive and happy, they have as well. And I can definitely walk alongside you and be with you when you talk to them, but they're the experts on that matter. And I try to stay away from any experiences I've had with medications. I leave it pretty blank. Like I did, like me personally, I did use Suboxone for a little bit. And I just leave it at that. I don't tell them if I liked it or I didn't like it. So I did use it for a little bit, and it's definitely a pathway. Encourage them that recovery is self-defined. Encourage them that, their recovery is their recovery, right? Um, and that what I will use is stories. If they give me their consent, I like to use stories. I have a few friends that have been very successful and still are successful to this day with other medicated assisted treatments, and encourage them as well that it's actually you do have rights uh with medical assisted treatment. You're actually protected, just like if it was a religion or race, or sexual orientation. It's a protected class. So like housing can't discriminate against you. You can't be discriminated against because you're on those medications. So I always let them know their rights on that too. Foster hope and be an example. You definitely want to be confident and be your most healed self because everyone's watching. The doctors are watching, nurses are watching, your peers are watching, the registered nurses are watching. Everybody's watching. The management's watching, and a lot of times, we're the only peer that they're going to see a lot. So you want to make sure that example is a good one. That way, if they get more funding or want to expand peer support in their program, they have a good example, and then they'll hopefully come to you as well, right? With helping build that program or gaining insight, and hopefully you can help them and create a good model for them, or just create a good team. And it's just very important. I think again, we're pioneers as peer supporters, and I think that we have to really identify the recovery model versus the medical model dynamics. Understand those things, right? And understand that a lot of these folks, they have tremendous education. A lot of them don't have lived experience, right? And that's it must be nice, right? In a way. But then also they think the same thing about us, believe it or not. Well, it must be nice to have that wisdom from experience and be able to relate to people on that deeper, genuine level. So understanding that, they're 99.9% of the time are going to come at you with a medical model. So don't take it personal if they come across as like robotic. Um, or disingenuous. It's just that they're looking at it from a different perspective, right? But then that also gives us the opportunity to show them the recovery model when we discuss it, right? And letting them know those things, those core peer values and stuff, referencing back to curriculum and referencing back to our lived experience in a good way. Encourage questions and provide thoughtful responses to enhance clinical buy-in. I call it creating champions. So like I've gone around Harborview here where I work and talked to the different doctors, given them my card, letting them know what I can offer as peer support, what peer support could do for them. For example, for like nurses, I let them know because nurses do a lot over the daily with peers, and let them know, if you happen to have peers who need support, someone to talk to, and maybe you can't talk to them for more than the hour you have or the half an hour or hour and a half, I can gladly, we could do a warm handoff and I can talk to them more. Or if even like resources, if they need particular resources, I can educate you on what's available, or we can work together, or I even will come in if they're not if the nurse or doctor is not feeling safe around a peer, and help diffuse that. So creating champions in different departments, no matter where you're at, because then they're gonna all of a sudden message you, and you're getting all these referrals to build your practice, right? And that's a great thing, and especially a place like this where it's big. Hospitals are big places and have a lot of different silos. So you create just a few champions, and after those creating those champions, I mean, I get a ton of referrals just from the fact that I worked hard on creating champions throughout the hospital from different departments. And I let them know, hey, in my specialty, it's with folks with SUD, but even if it's not, and I've been able to make some really good connections with peers that way, and then also been able to stay busy always, and also been able to be invited to other trainings and other events and have conversations and be in rooms that peers should be at, and then hopefully I can make space for other peers to come in those rooms too, right? And or get that information like a mother bird, right, and give it to my other peers in my department and show them, hey, I'm not gatekeeping, don't gatekeep. Um, Act as if, remember that peer work is new age. When folks think of having lived experience, there are usually stigmas and biases you're going to face. So again, that referencing back to being confident, being your most healed self, because everyone's watching, and that might be their only example of somebody with lived experience, right? So you want to give them a good one, and not just for yourself, but for others. If there are other peers that are hired, you want to have that groundwork laid down and a good foundation that, not only is it beneficial to have it, but also these are folks that you want to have on your side. Just like we want to have the medical staff on our side. Communicate and educate. So reference your training when facing oppositions. Always use that as a reference. Sticking to the basics. Don't be afraid. Um, we are on a team to wear that peer hat. We're there. They've made space for peer support workers to have that hat and to have. So as long as you're doing it from a place of love, and as long as you're doing it from a place of healing, and as long as you're not coming from ego, and you're doing it to better take care of the peer and to give them the best experience possible, and to be and to promote positivity, you know, and encourage the clinical team to take the HCA modules and research different materials on peer work, and also referencing back to being open and confident to do presentations, whether in person or virtually. I've been invited, like doing this one, but then I've done some on a national level with some other consulting work that I do, and I've also been asked to do like presentations here in the university. The University of Washington's huge, and it's a big medical school, and so I've had them, ask me to come and talk about my lived experience and talk about what peer support work is, and integrating that further, and also letting these students know about it so that when they are done with their education, they can go in to the workforce and already have a really good example and a really good knowledge of what folks with lived experience can bring to the team and that overall healing environment. And doing outreach and seeking network opportunities. I'm fortunate here that I have a lot of autonomy to do that. Some jobs may not, or they might have lanes. For example, when I was a peer support worker in the jail, they had a reentry worker that was more of her lane, her wheelhouse, um, was doing like the outreach side. So I had to learn and be respectful that I'm more there just for the peer support. But then over time, I was able to kind of, because she was so busy, able to, because I had a good experience with outreach, able to do more. But depending on the autonomy you have in your job, and sometimes maybe that's a conversation you can have with your supervisor. Like, I'd like some autonomy, self-advocate for yourself, to network. And you're only going to learn more. That's how I do networking. I think you can look at networking from two ways, right? How you can benefit or how your peers can benefit, right? And fortunately, I feel like being at Harborview in a pretty damn good place. So a lot of my networking is for what can I learn to help my peers, and what can I learn to do this at the highest level possible so I can execute, and so I can make sure I'm making space for everybody, and making sure that I'm healing people, and making sure that I'm using my bad for good, that I'm replacing all the damage that was in my life and all the negativity in my life, and I'm replacing it with good, and I'm using that to help others, save them time. And that to me has been where I've been blessed, is the less I'm in ego and the less I'm doing it to heal and to be a source, the more I get. And I can't encourage that enough, is that if when we give, we gain so much more. And outreach also, there's a lot of little things you'll learn that you can also create champions with outreach as well. Because when you go to different areas, a lot of times they want that. They want folks like us out there to be able to connect to. And then a lot of times you can learn, like I learned an option over here at a church that they pay the full price to get them a license, or to help with their CDL, or to help with like a flagger's card. So now if I have peers that are willing to, willing to jump through the hoops, and they show me that resiliency and that self-advocacy and that confidence and that hope, then I can walk with them just 2 blocks from here and get all that taken care of for them, and they don't have to worry about paying for anything, and it's done. Um, Effective delivery techniques. This is a powerful tool in public speaking, just like your pitch, your tone, your volume, to convey your emotion, emphasize points, and maintain interest. Your pitch variation, tone variation, volume control, your body language, right? You don't want to have your arms crossed or hands in your pockets. I try to smile and just meaningful eye contact. Like, you don't want to just stare at somebody the whole time, right? But right. But when they're looking at you, and look at them too, and let them, and try to give that vibe that you're just there to be cool, and there's no bad agenda there. Gestures to encourage that too, right? Or even words of encouragement or hope. Maintain good posture, head up straight, back straight. Control your expressions, right? Make sure you're not making the RBD, the RBF, right? That's one, I myself was a victim of. Stay out of your head in those times. Navigating Q&A sessions, know your material in advance. A lot of us, believe it or not, I think already have, because we have our lived experience. It's different, right? It's not academic. We don't have to study for it. We lived it. So a lot of that we already know in advance, and we can just, believe it or not, you already have a lot of stuff you can reference. and utilize to share with folks who want to learn about and get gain from it. You can also rehearse. I've rehearsed before, like just like when I'm driving. A lot of traffic in Seattle. So if I have some traffic and I need to rehearse, I can rehearse during that time. Or I'll even rehearse like in front of my girlfriend or when I'm lifting weights, rehearse it in my head. Um, maintain your composure, staying calm, listening, maintaining eye contact, um, speaking impact. Your ability to communicate will leave a lasting impact on your audience. Um, Effectively communicating involves delivering your message, but also, resonating with the experiences, values, and emotions of those listening. So, most folks have family or even like siblings, or not his family, but like, partners, someone they've loved who has either passed away or been affected by something in the lived experience, whether it be with the mental health or the SUD, or being unhoused. So a lot of folks, when you can tap into that, it opens them up, and they'll definitely be listening and can use that to even maybe even be peer support for them too, right? Don't be afraid. Our curriculum and administrative staff, especially at the state level, like your Amanda Polly's, they're easy to reach actually. A lot of folks that I talk to here that I do peer work with, they're like, really? And I'm like, yeah, dude, just call them or email them. I mean, it's not a bad thing to know your rights or to know what support you have or know what guidance you can get from them, right? Or what events are going on or all that stuff. Stay connected. Learn to infuse energy into spaces. Of course, you want to make that good impression, and you want to leave them better off than you got there. And that's they're going to remember that. If you worked hard to create a good space and be encouraging and be positive, they're going to remember that about you and reciprocate that and possibly open up some opportunities for you or for your program or for people that you're training or mentoring. Have an open ear and open mind to calls and trainings you can plug into. There's a lot of stuff you get with the HCA emails, but then there's also other places you can connect on a county level, on a state level, on the national level, even other people that you know. Um, all you gotta do is ask. With social workers or anybody else, case managers or other peer workers or supervisors. You know, just closed mouths don't get fed, right? All you have to do is ask, and a lot of times they're gonna let you know, and then that can create more and more opportunities. You got the Washington Peer Network. You got peers from all over the state on there, and it's in real time, and there's a lot of events on there that peers can do and sign up for. And I think, the more and more we encourage that and the more and more we connect there, that's just all for the better, right? And you can even look for jobs there and stuff or post jobs. You got your healthcare authority staff, um, and then seek and create a circle. So I've been, that's kind of what I do. Some of my circle includes 12-step sponsored people, to people in my faith, to people in my culture. My mom's from Mexico, so I have some folks from my family side there. Um, also people who are like looking to become peers are in my circle too, because they've have a lot of lived experience and I've learned from them. And then I in turn am able to show them what hoops to jump through or encourage them or help them with their resume. But that's important too. You want to have a healthy circle because that's just going to reflect in your the way you conduct your peer work on the daily basis. Self-care, last one, right? Which might be the most important, especially when you're working in a hospital, because it can be very stressful, very demanding. You have to be flexible. You have to be person-centered. Relentless pursuit, daily fill others' wells, right? We're filling people up, so we have to keep our well full. That's how I use it. That was my first ever mentor, who passed away. That was one of the first things he taught me early in my recovery was, we have to keep our well full. Um, you have to like recovery, it's self-defined, right? So like self-care could be different for everybody, and it is different for everybody. So don't, if they ask you for suggestions or what you do, definitely share it, but it's not the end all be all. For example, I like sports. Some people hate sports. So then I look like the idiot who is just all like a sports nut, right? So, but for me, it's like I enjoy it. I enjoy going to a ball game or I enjoy watching a football game or the NFL drafts coming up in 10 days or 9 days. I'm gonna probably like hang out and like watch that and like I have mock drafts I do with friends and fantasy leagues. But for some folks, it's like, what the heck is that? So always remember that it's self-defined. It can be different for everybody, and just encourage them to seek happiness and seek goodness and seek their truth. If you find your schedule too much, don't be afraid to talk to your leadership that you need space for self-care to stay on point. And a lot of times our medical benefits can help with that, or even they might even give you time to maybe where you're still being paid, but you could go, or if you have to use sick time, but try to leverage that. I know sometimes there can be constraints on that, but a lot of times if you're communicating and you're letting them know, they understand that our work is stressful, especially in a hospital, and they're going to help you in that way. Another way too is to seek ways of self-care like within your frame of work. For example, here in the city, in Harborview, I'm on First Hill, which is a neighborhood with a lot of hills. So one of my walks that I do for self-care is I walk from here to Capitol Hill and back, and that's about a 2 mile round trip walk and some hills. And so, I put in a good podcast and do that, and I can do that within my work schedule, like during my lunch break. And then if it gets too strenuous, I can take the trolley back, but I've gotten good at it now where now I'm working on getting faster. Um, or there's even these big hills up James Street and up Madison that are or James Street Hill is pretty challenging if you go all the way down to the Pioneer Square station. So I'll walk down to Pioneer Square station, then walk back up. And after that, my calves are killing me, but I feel a lot better. Things like that. Find stuff within work. Maybe your place has a gym. When I worked at the jail in Olympia, Thurston County Jail, they had a gym in there so I could lift weights in there when I wanted. Um, and also, self-care enables us to model self-advocacy and resilience daily, right? So that makes our approach real and strong, and we can use those references to be able to share in the moment when we're given the peers consent to let them know things you're doing on the daily basis, and not just having to make stuff up. And I don't say that to attack or anything, but I think sometimes we could be so consumed by work that we forget ourselves. I've been a victim of it. I still am. Um, but as I've gotten older and got more grays in my beard here, I've learned to I've learned to understand that I have to make space for that, for self-care. Like I have to, even if it means calling in sick for a day, even if it's going to be busy, but you need to be able to, I've had days where I'll call in and I just like I'll sleep all day. Like I'll sleep, maybe cook some food, and just rest, maybe do some laundry, but just, I won't even be on my phone, anything like that. And it also keeps the hope going, right? Because if you're doing it for yourself, it enables you to keep doing it and to keep encouraging that to others. You want to seek feedback as well to see if maybe you could do other things in self-care, or maybe it could be healthier, or even be done better, or maybe there's other places. For example, we were talking about our medical team was talking about different places and online and in person to do like yoga and Pilates this morning. Reflect on your performance. You know, are you feeling more anxious? Are you feeling tired? Are you feeling drained? Are you annoyed? Are you like lacking empathy? Maybe you're not performing in self-care, or maybe there's something going on there you need to talk to address with your management, right? Explore new techniques, look for things different. Yoga, never would have thought about that, but I'm looking into it. Hiking as well, I'm looking into myself, but look for new techniques and things you can do. Set personal goals as well. So, I mean, that can be different for everybody, right? Um, an example I have is when I first started a couple years ago working out again. I just started going like once a week, and then I started going twice a week. Then I started going 3 times a week. Then I started, lifting heavier, lifting the heaviest weight I can lift, and then I started doing some cardio. Um, just get momentum going, and just look and make you want to make your goals realistic to where you can achieve them, because if you don't achieve them, that can discourage you, right? So you want to create goals that are still good and still have milestone effect, and still create that journey and that accomplishment, but then also aren't too hard to where if you don't hit them, then all of a sudden you're actually making yourself more down. Um, and then execute and keep on keeping on. Just keep, because when the more we execute on everything, I'm a big um I'm a big fan of manifestation and a big fan of momentum. So like to me, it's like if I'm creating that positive momentum and I'm manifesting the best to happen in my life, it doesn't mean the doors aren't going to get shut on me. It doesn't mean people aren't going to like me. Everyone's not going to like me. I understand that. What people say about me is none of my business, but I know that there's going to be other doors that open in other ways. And then when you're coming from a place of self-care and coming from a place of relentless pursuit, and you're coming from a place of being your best healed self, you're gonna see it and be like, oh, okay, I see what's going on here. That yeah, that door got shut here, but all of a sudden this door opened, and I'm actually in a better, like probably in a much better place here. And then again, that gives us more material to use in our peer work too, right? Um, so I'm just gonna close out with just thanking everybody, taking the time to see me and give me this opportunity to present and self-care for me. This is my work number. Feel free to call or text it anytime. Harborview is a big hospital. We offer a lot of services. Would love to be a bridge for anybody here. Um, or if you have any peers that are interested in working here at Harborview, I know we have some openings. You can forward them my number and I can talk to them about my experience and whatever they want to know. That's my work email. It's rjl5@uw.edu. And then my personal email is trustandlove.220 916 at gmail.com. And thank you.